Hey everyone, this is the FNC Concussion and Brain Injury Summit in 2025, and my name is Dr. Ryan Harvey. I'm a chiropractic neurologist and certified functional medicine practitioner here at our office in Minnetonka, Minnesota. So today's topic is going to be around the metabolic drivers of concussion. So let's just kind of start talking about what kind of things could be causing it, stalling in my recovery from my concussion, right? What is a concussion anyways? A concussion really is a mild traumatic brain injury. And so really when people think about, oh, well, I had a concussion, and you say that, people are like, oh, well, you must have bonked your head, and you're feeling a little off. But really, in most situations, you're actually having traumatic injuries to the brain when you have a concussion. And so that can really lead to persistent symptoms, and it can be like anything but mild long term. Some of the common symptoms around concussion are things like brain fog, cloudy focus, headaches and head pressure, dizziness or changes in feeling like I can handle visual motion, like being in a plane or a car or going on the train or things like that. Having changes to your sleep or your mental health, like anxiety and depression, and then having, pretty intense fatigue, both neurologically and, potentially cardiovascular. Um, so, what are some of the factors that could be driving around more than just I hit my head and I had some immediate symptoms? Like, what could be some things that could potentially be causing me to have prolonged concussion symptoms and maybe be camped in that category of post concussion syndrome, right? So when your recovery stalls, many times there's more than just that initial impact that are leading to you not being able to recover appropriately. Some of the common drivers that we see here in our office are things like chronic neuroinflammation. So, when you hit your head, you have what's called the metabolic inflammatory cascade of concussion. And areas in your brain can swell up very similar to as if you had like rolled your ankle, right? Tissue swells, and then tissue depletes swelling over time. Well, in the nervous system, especially the central nervous system, there's a protective covering around the central nervous system called the blood-brain barrier, and it doesn't let a lot of particles in or out. It's it's very tight junctions. So, the inflammation in your brain a lot of times doesn't reduce at the same rate it does outside of the nervous system due to that protective covering, which is a great thing to not allow infections, into your nervous system and things like that. But when you talk about inflammation, we also want to get rid of some of those byproducts of inflammation, over time as well. And so brain inflammation can be, there for a long time after a head injury, and it won't reduce the same way it would if you rolled your ankle and you would expect that inflammation to go down in a few days. Other things like chronic infections can really reduce your brain's natural ability to heal. So if you have something like I've had exposure to Epstein-Barr virus, or I had complications with the chicken pox, or I had complications with things like Lyme disease, or babesiosis, or Bartonella, or ehrlichiosis, or all these other types of viral illnesses. These type of things are dormant viruses that stay in your bloodstream, a lot of times throughout your life. And so if that's the case, when you hit your head and you have changes in your immune function, those viral particles can come back and fester, and they can replicate, and they can cause more neuroinflammatory responses. So this can really reduce your ability to naturally recover from something like a head injury. It's almost like if you were saying, "Hey, I want to go add on to my house, and I want to renovate my house and build on a new room," but you had a flood out in the yard. It would probably not be a great time to try to renovate. The same thing can happen in the brain, where if there's some other inflammatory markers or other driving inflammatory systems happening, then you might want to start working on some of that stuff before you start to do really intensive brain-based rehabilitation, or maybe trying to do these things synonymously at the same time could also be more valuable than just doing one or the other. Other types of environmental toxins can really reduce your probability of recovering from a concussion. So things like toxic mold exposure, mycotoxin illness, toxic exposure from things like maybe the air you're breathing if you're having poor air quality. From the water you're drinking, from if you're having any kind of immune reactions to some of the things you're being exposed to in your food, or and things that you're using, like your soaps and your deodorants, and all these types of things. These environmental exposures can really reduce, and they can cause inflammation and reduce your natural ability to heal from things like a head injury. So these are all educational factors to say what other things could be relating to my prolonged concussion recovery, more than just I hit my head and I haven't recovered within a couple weeks. Some of these people are having months or years of symptoms after head injury, and many times there are other drivers of inflammatory responses that are reducing your natural ability to heal within a normal timeline. So metabolic dysfunction, right? Do I have other underlying comorbidities? Am I diabetic? Do I have hypertension? Do I have autoimmune history? Am I anemic? Do I have any other things going on in my blood chemistry that would reduce my natural ability to heal as well? So neuroinflammation, it's a really a double-edged sword. What happens is that we need the inflammation to be there so that we can, be able to prune neurons that got damaged and be able to clean up the debris from an injury. But we also, it can affect other, normal functioning or healthy neurons as well if it stays and it festers for a long time. So, microglia are kind of like they're the janitors of the brain. They help clean out dead neurons. They help get rid of some of the byproducts of cellular activity. It cleans out debris, but they can also become very overactive or they can become very primed. A lot of the literature talks about microglial priming, where these immune function cells become very active and they start to potentially attack healthy tissue as well, and they become overactive. So if you're having chronic effects, sometimes you could have cytokines, which are another form of immune tissue function that you have too much of that, and it can cause more brain inflammation, which can relate to things like changes in cognitive processing speeds or reactivity. Oxidative stress, whenever your cells use oxygen, they create what's called free radicals or oxidants as a byproduct. It's almost like you burn gas in your car and you create carbon monoxide as a byproduct. You breathe in air, you create carbon dioxide as a byproduct. In a cellular fashion in our cells, we actually use oxygen to make energy, and we create a byproduct of what is called a free radical or an oxidant. And what that is it actually can deteriorate other parts of our cellular function. That's why they'll tell you've probably heard, oh, it's important to take antioxidants, because what they do is they help you get rid of the oxidants that build up from breathing air and building energy for your cells. But having very high levels of oxidative stress is really going to change cellular function, and it's going to potentially damage your mitochondria, which are the areas of your cell that make energy for your cells to be able to function appropriately. The blood-brain barrier has breakdown, and when that does, we talked about earlier how that can change how we get rid of inflammation, but it can also, if it starts to break down, we can also have things cross over into the central nervous system that shouldn't be crossing over. So things like toxins, things like viral particles, things like inflammatory markers can cross over into the central nervous system and cause brain problems that should not normally happen if you have a healthy, functioning blood-brain barrier. And this can also really, affect your sleep, right? If you have an inflamed brain, this can, relate to poor detoxification or getting rid of the byproducts of cellular activity, and not have appropriate repair of neurons whenever they're injured. So, concussion really can create what is we think of as an energy crisis. Are you creating cellular energy appropriately? Are you making enough gasoline for your cells to function? And are you using energy at an appropriate rate? Meaning that, am I getting 10 miles a gallon or am I getting 50 miles a gallon with my brain? So it might be something like, oh, I can still read, after my concussion, but I used to be able to read for hours. Now I can only read for 30 minutes. We could think about that as potentially a energy crisis, right? Maybe I'm using more energy than I should be to do things like reading, or potentially I'm using energy at a faster level than I should be. Um, or potentially my cells aren't creating energy appropriately in terms of creating as much fuel as I had prior. And this is a cellular injury that really commonly happens after a head injury. So, your glucose metabolism can falter in terms of like maybe I don't absorb sugars as well. I don't use them to create energy as well. Really 20% or more of all of the energy in your whole body, cellular wise, is used by your brain and your central nervous system. So after concussion, that can become less efficient, and you can start burning fuel at a faster rate, or not creating cellular energy appropriately. So your mitochondrial ATP drops. Your mitochondria are what creates ATP, which is the cellular currency for energy. Adenosine triphosphate is how our cells use. Think of it as cellular gasoline. So whenever we drop, that means like we used to have 10 gallons of fuel to start the day, and maybe now we only have 5 gallons of fuel, which means that even if we do the things we did previous to our injury, we're going to fatigue a lot faster, and we may create symptoms due to that lack of cellular energy. So there may be more demand than there is supply of cellular energy. So maybe I'm trying to do all the things I was doing prior to when I had 10 gallons of fuel or ATP, and now I'm doing that with only 5 gallons, and I'm creating this energy bankruptcy, or I'm really running my cells ragged when it comes to not having enough fuel to be able to use those areas of my brain appropriately. This results in things like chronic fatigue problems, brain fog, exercise intolerance, a multitude of different things. So again, we talked about some of the hidden amplifiers of concussion symptoms, right? And so it might be like I hit my head and I started to create all these symptoms and they didn't get better because there's other things that are inhibiting or stopping my brain from naturally healing. These things mimic PCS, or post-concussion symptoms. So, these things are also overlying where it's like, oh, well, I have fatigue and it's from my head injury, but is it also from something like a metabolic condition like we talked about, like an infection, neuroinflammation, comorbidities, other things that are pouring gas on the fire, for lack of a better word. Lyme disease and viral infections really keep microglia active. If your immune system's constantly fighting off infectious particles, this can really ramp up, how active they are, and then they can start to attack healthy tissue in certain situations. Co-infections like babesiosis, Bartonella, Ehrlichia, anaplasmosis, all these other things that are very, commonly carried in things like ticks and mosquitoes and fleas and things like that. They worsen immune function and they create vascular and oxidative stress. So, concussion recovery can stall whenever all of these other factors are becoming intense for your nervous system to handle and your cells to be able to function appropriately. So, and there are also these toxic roadblocks. So more than just infections, we talked about that as environmental exposure. So things like mycotoxins, those can cross over into the blood-brain barrier. They can impair mitochondrial function and how your cells make energy. They can drive inflammation. They can create some of these conditions like we list here, like CIRS, or chronic inflammatory response syndromes. So failure to clear these toxins creates chronic immune activation, or those hyperactivity of your immune cells. And this can mimic PCS in symptoms, right? So you could have some of the same symptoms you'd have had you hit your head and not had these going on, and they can amplify some of the symptoms that are really common, like brain fog, dizziness, fatigue, autonomic dysfunction. And overall, we want to see recovery, not stall, and be able to see major improvements in recovery over time, rather than just riding the roller coaster and feeling you had a good week, a bad week, a really bad week, an okay week, and just unpredictable in terms of your recovery. So our approach is really twofold. Not only do we want to handle some of those, concussion markers from a visual, vestibular, autonomic, proprioceptive standpoint, doing all the therapies that help improve brain function, but we also want to be able to reduce the inflammatory response, the immune hyperactivity, and improve how your cells make energy. So in conclusion, the main points that I want to get across are that persistent post-concussion syndromes they're both biological, but they are, very treatable. So when neuroinflammation, infection, toxicity are all addressed along with the neurorehabilitation side of care, patients really, see major improvements whenever they weren't seeing improvements just doing the rehab, which is an important concept. Our mission here is to really restore how the brain functions, how the cells make energy, and then create life to be more of a therapy for you. Where, I used to be able to go play tennis, and that was a great therapy for me, but now I can't do it because I get dizzy. If we can add in things to your life again, that can be therapy for you, and that can rebuild your tolerance and recondition you to doing everything else in your life. So I hope this helps. I think it's really important to understand the twofold. What are the other factors that can relate to why I'm not recovering at the speed that I should expect, and understanding some of these other drivers. So I hope this is helpful, and thank you guys for joining the summit.